So your work really has a lot to say about even human populations and how we might be thinking about why some groups get more sick and others get less sick in age, how long people last. If you were to give a lecture to medical students, what are the main points you'd like them to understand about your work and trade-offs and early adversity in health?
Well, I think the big thing for me is building awareness that these have as large of effect sizes as they do. Things like social status and social integration, we're still working out exactly what the mechanisms are that relate them to mortality and health, but I think the evidence is just, completely overwhelming that they have huge predictive effects. So if they want to know whether their patients are vulnerable or not, it's very important to do things like, measure body mass index and check cholesterol and all that kind of stuff. But it may also be important to understand how vulnerable they might be from the perspective of what their social lives look like. And that sounds maybe a little loosey-goosey.
Sounds soft, yep.
Sounds soft, right? But, regardless of whatever error goes into measuring that, it's coming in study after study that knowing that information tells you something about how vulnerable your population is and how vulnerable your patient is.
So my colleague and friend back at University of Michigan was Jim House, who did some of the original studies showing that social support, even after you take out every other effect, is a really powerful predictor of how people do.
Right. And it's one of those things where, okay, well, what do you do about it if you know that? If you're a doctor and you find out that you have a patient that's come in who is fundamentally really lonely, you're not going to say, well, just stop being lonely, right? But there are actually, this was just covered in the New York Times a few days ago, there are mechanisms that societies have put in place to try to deal with it. They were actually talking about a loneliness hotline. What do? You call in and talk to someone. There are people who call in and talk to people every hour. And there's possibilities that if you know that this is a predictive factor for your patient's health, if you really understand that one of the biggest predictors of cardiovascular disease is socioeconomic status, then maybe you start thinking about what you can recommend or what you can do. I mean, it's never going to hurt anyone to go join a bridge club or something like that.
That would help. So I was originally a doctor doing psychosomatic medicine. There was a very famous study about a small town in Pennsylvania that had been very tightly integrated. Everybody knew each other. There were regular conflicts between different religions and stuff, but it was a really tight, small community. And then television came in, a new industry came in, a new industry went out, and the whole social fabric really disintegrated just in about 10 or 15 years. And they documented dramatic bad changes in the health of the community, even separate from smoking and drinking. Dramatic changes. Now we're going to switch gears.
Okay.
So are there things we might be able to do for children in their first years of life that might help their health throughout the rest of life?
Yeah, I think there's pretty good evidence that both good nutritional support early in life and good social support can make big differences at that particular time. There's been study after study, both using what we call natural experiments in humans, cases where nobody intended to deprive kids of social well-being or nutrition, but it happened anyway. So a lot of those kinds of studies that have shown that when that happens, you get increases in all kinds of disease burdens later on in life.
What are some examples of those bad situations?
So one of the most famous ones is called the Dutch hunger winter, which was a famine in the Netherlands that was created by a Nazi blockade at the end of World War II. And, some of the caloric intake went down to, as low as 600 calories a day. And so kids who were gestating at that time, whose mothers were pregnant during the blockade, grew up later in life to have higher rates of heart disease relative to their siblings, right, who were born outside of that narrow window. There's been some documentation of
I
higher
thought eating
rates.
too much was supposed to cause heart disease, not too little.
Yeah, so these kids grew up in a healthy environment, right? So they grew up in a relatively wealthy country, the Netherlands.
Plenty of food
after
available.
the war,
Right.
Yep. It was this particular point in time when they were developing in utero that seemed to create this kind of long-term sensitivity.
So did it cause disease directly or only because they became obese and other things in the meanwhile?
I think that I don't know.
Okay. Because there are some people who think that nutritional deprivation in utero leads individuals to eat more, and that causes other problems.
Right. That's
and I think another of your studies
Yeah.
Kind of challenges the idea that there might be anything useful about that. Is that correct?
Yeah. So one of the explanations for these sort of long-term early life effects resulting in disease is about a mismatch between early environment and adult environments. And it's the idea that there's this sort of physiological information transfer between mom and developing infant about the environment that that infant is likely to face when it grows up. And so if the infant is developing in a period of nutritional deprivation, like famine, then it's sort of programmed to do reasonably well in a situation of famine later in life. And so under this kind of idea, what might have happened in the Netherlands is that these kids were basically sort of being told by their mothers' bodies that they were going to grow up without food. But then they grew up in an environment with lots of food. And it was that kind of mismatch that created health problems.
Right. So it sounds like you would like to advocate for taking the best possible care we can of kids, and we will get benefits throughout the whole rest of life.
Yeah, I think that that's definitely the case.